I'm a frontline harm reduction nurse for Alberta Health Services. I know abstinence is not an approach that works for everyone. And I think harm reduction is a very kind, a very pragmatic, and a very accepting approach. And I know that there's always a better way to do things.
All right, that was tonight's guest, Jennifer Eyford. I might have said that wrong. Jennifer Eyford. I'm Daniel Unmanageable, and this is Hard Knocks Talks, coming at you from Saskatoon, Saskatchewan, Treaty Number 6 territory and the traditional homeland of the Métis people. Let's bring in Jennifer. Hey, Jennifer, how are you?
I'm good. How are you, Dan?
I'm good. Did I say your name right?
Yes, you nailed it.
Oh, good, because I know I said it wrong before the show and you corrected me, and then it got into the moment there, and I'm like, oh, God, I forgot how to say it again.
Very well done.
Excellent. Thank you. So, is there anything that you would like to say before we jump in tonight?
Yeah, maybe I'll just say that I'm a raging introvert, and if I don't have to be in the limelight, I will certainly choose that as one of my options. On the other hand, if I get to talk about things that I'm passionate about, sometimes it's hard to shut me up. So I'll leave that to you to manage tonight.
Okay. Well, I'll do my best.
Jennifer,
Okay.
you're a girl after my own heart. You sound just like me.
I was gonna say Donna is very much the same, but she does it because it's for the greater good. So, but with that, let's jump in.
This is Hard Knocks Talks.
Okay, before we dive in, I just want to let our viewers and listeners know that tonight's live production is title sponsored by the Saskatchewan Union of Nurses, and we have joining us live on the stream their president, Tracy Zambori, to say a few words. What's up, Tracy?
Hey, Daniel. Well, how did you know that you were going to have 3 women that you might have to control how much we talk?
I can't.
Good luck to you is all I can say. It's good luck.
I never, in my wildest dreams, imagined that I could do that. I am hoping for the best this evening. Pray for me.
Yes. Yes. Well, and we couldn't be any more proud as the Saskatchewan Union of Nurses to be able to sponsor particularly Jennifer's conversation with you tonight on harm reduction. As we know here in Saskatchewan, harm reduction is a very difficult thing to speak of. It raises a lot of red flags for people because there is such a lack of understanding. And I'm glad with conversations tonight with Jennifer, we can break that stigma. We can push down those barriers and have people listen and understand that harm reduction is what is absolutely required. We're so lucky to have Prairie Harm Reduction in Saskatoon. We have an overdose prevention site in Regina, but we need to have this kind of harm reduction across Saskatchewan, in fact, across the country. There should be no issues about it whatsoever. So it is, it's so incredibly important that we have these types of conversations, and we are so
That was Donna's fault, 100%.
I'm sorry, I pushed the
That was
wrong
Donna's
button.
fault. Yeah.
That's all right. I mean, come on. If we can't laugh at ourselves, we're in tough shape. And the fact of the matter is that this isn't about me. And so it's okay. You flash me on and off. It makes people look even harder at what we're doing here tonight. But this conversation is much needed. It's the next step that we have to have when we're talking about a concrete mental health and addiction strategy. We cannot move forward without conversation around harm reduction. And, really, it's not about me talking. It's about how proud we are to be able to sponsor this episode. And we really are proud of our relationship with you, Daniel and Donna, with Hard Knocks Talks. It's really important to us organizationally and as registered nurses in this province, because as you know, we are in every community, every facility agency in this province, and we are the ones that get to see firsthand the ravages that addictions brings to our loved ones. And we know that we are already on track to have significant numbers for loss because of not being able to properly manage our loved ones who have addiction and mental health issues. So these kinds of conversations are pinnacle to break down those barriers, and we're really proud to be able to sponsor that. So, awesome. That's me for tonight. Let's get on with the important conversation with Jennifer, and I look forward to sitting with you again, Daniel, and giving you a hard time and causing you to have some anxiety on whether we're actually going to get there or not.
We always do, Tracy, and And have saying what you said, it is an honor to be trusted with your brand, to fly your flag. It is an honor to have you on. And I guess that's it for now, my friend. Take care.
It is. Good night. Yes. Good night.
Nice to meet you.
Okay, all eyes on Jennifer. Jennifer the introvert.
Yes, bring it on.
Yeah. So, okay, when I first saw you, I heard your talk at the CSAM conference in November here in Saskatoon, and I was moved very deeply at your vulnerability when it came to working alongside harm reduction workers, particularly ones with lived experience, boots on the ground, so to speak. Tell us about what it is that brought you to finding such compassion in harm reduction in the first place.
Yeah, I think I have a fairly unique background. I shared at the talk that my life started under fairly difficult circumstances. That the person that was pregnant with me had no plans on keeping me, and had actually planned to have an abortion, but missed that deadline, and shared that 20 years later with me after I'd been adopted into a wonderful family. And I had always wondered why I had struggled with belonging, and why life just sometimes felt just extra hard. And it just made a lot of sense to me. It was a very painful thing to learn about my past, but it also was a very what was really important for me to understand myself better. But what I think it brought me was just a really keen understanding and compassion for other people that didn't feel that they belonged. And I think that brought me to the work with working with marginalized populations, where I think disconnection and not feeling they belong, issues of unworthiness, that those are the biggest issue for them. So I think, due to my own difficult background, I was able to just understand this on a really visceral level. And just from day one, I started in psychology, focused on mental health, was really privileged to add a nursing degree in later life, and have always been really drawn to folks that at the end of the day didn't have as lucky of a life than I did, because I really lucked out being raised by a family that gave me all the resources, all the support. And I think what I always appreciated is that the difference between myself and someone who is, for example, using the supervised consumption side is very, very marginal. And I think there's a lot of us and them in the society, because it feels safer to say, oh, I could never be this person using IV substances. I could never be the person homeless. And the truth is, we all could be that person if circumstances would have been different. And I think we like to forget that. And I think I always appreciated that there is very little difference. And with that, I really sought a life dedicated to service. I know that sounds really terrible how I say it, but serving and giving back became really, really important goals of mine. And that's where my job satisfaction is. That's where my life satisfaction is. So working alongside folks that have great difficulty in life, and then especially working with folks with lived experience that I deeply admire, and the resilience and survivorship that I see in my peer coworkers just really humbles me each and every day. So I have the unique opportunity to work in leadership during the week and do the frontline nursing on the weekend, and it's working very well for me.
So before we get too far ahead, let's take a step back for a minute and tell us about your experiences. So, I mean, you're a nurse. You mentioned that you were in psychology. What was it like when you came out of school and started putting your skills to work in the community? Was it quite jarring for you the first time you started experiencing frankly, the pain and the suffering that's out there?
I remember feeling very unworthy doing the work that I was doing. I felt I didn't know a thing. I felt I had very little to contribute. And it took me quite a bit of time and a lot of mentorship to really understand that I do have something that I can bring to the table. It wasn't as jarring for me. I think I always was very eyes wide open to the atrocities in this world. I always knew, even though it wasn't my path, I always knew that there is a lot of suffering in the world, that there's a lot of social injustice in the world, that bad things happen to good people. And so it wasn't as jarring, but I really had to find my groove and start to understand what it is that I can bring that can help other people move forward.
Mm. So what was it then when you just mentioned that you felt unworthy early on? How did you find your feet? Like as a service provider, I think it's important to know, you've already been vulnerable with us. How did you find your strengths in service?
That's a very complex question.
I'm
I think
sorry.
it was many things. The gift that I have is I've always been humble enough to ask for help. And I've always sought out mentors that I knew would help me be a better person and be better at my trade. So that was something that I utilized a lot. I've always had a therapist in my life, and being able to have a very skilled sounding board to be able to dig a little bit deeper and to unearth those difficulties that often come from childhood and early childhood experiences. That was hugely impactful. And I also want to be really honest. It's also really easy to hide under a professional front. I think in medical, in healthcare, we see that a ton. That the doctors, the nurses, the therapists. It's very easy to just hide behind the knowledge that you have learned in school, and you talk about the statistics and the treatments and the numbers and the outcomes, and you can beautifully hide behind that and never really be authentic and vulnerable. So I'm sure I did that a ton early days, until I really was able to make headway in my own journey, which then enabled me to be authentic and really honest to myself and those I work with. And I think my clinical practice and my humanness dramatically improved by doing that. But I'm sure I was hiding a ton, just because that's all I knew.
Mm-hmm. Have you, I guess maybe I got a good place to go would be, tell us about the first experience you had working alongside a peer support worker with lived experience.
I always knew that this is the magical ingredient in healthcare, especially addiction care. What I see in different settings way too much is that peer support staff are being utilized what I would call as generalists. If the receptionist calls in, then they're the receptionist. If filing needs to be done, they do the filing. I always knew that lived experience is that connector, that conduit into services, that element that can bring hope and connection and trust, that I always looked at myself as a student that can learn from peer support, not just as a box that can be checked off. Yeah, we have peer support, we're doing all the evidence-based practices, but as a critical piece of the treatment team, and not just an afterthought. And I've always truly enjoyed working with peer support, and do want to always learn how they engage with clients that, often us without that lived experience piece don't do as well. And we all know we are social beings. It's all about the connection. We all know the saying, the opposite of addiction is connection.
Yeah.
And yeah, and peer support workers do that, and we have so much to learn, and that is something that I really enjoy doing, and get better at what I try to do. I try to connect with my clients, but there will always be this one final piece that I can't provide. And I'm looking to my peer coworkers to do that for me and to model it so we can all get better healthcare practitioners.
Mm-hmm. So tell us about some of your experiences that you've had working alongside lived experience peer support workers.
Where to begin? There's so many because I'm very lucky that every single setting I work in, we have peer support. So maybe I start with the Alex, my full-time job where I support mental health and addiction in a more of a leadership role. And we formed a peer support working group. And it's a group made up of peers, frontline staff that are non-peers, and also leaders that that support peers. And we meet regularly and talk about peer issues and talk about how we can bring peer work to the front lines more efficiently. And we always do a checkout because we always appreciate that some sensitive issues could be touched, kind of feeling heavy, and that something is not really resolved. And we do a checkout. And what we always say at the end is, wow, this was another incredible meeting with a lot of humble learnings. And that always comes from the non-peers. And the peers go, wow, we're glad that we were able to share our views and share our work with you. And we're like, wow, lesson received. Thank you so much. So that is a peer support experience that I regularly have. That is more on an administrative level. Working at frontline clinical programs with peer support is just it's a real partnership. There is one program I work with, and it's an outreach program bringing addiction medicine to the people, which I, as a side note, totally believe is the way to go with healthcare. Bring the services to the people. Don't expect them to come to you. And my partner in that is a peer. And man, I step back and I just watch them perform their craft. And I'm kind of like the arm candy. So it's something that deeply satisfies me and just kind of makes me proud to be able to have that exposure and to contribute in my own ways. But it's the peer support where it's at. So
yeah, that's an interesting point of view. Bring the medicine to the people, and it would seem that. And I'm not as familiar with the Alberta model as I am with what's going on in Saskatchewan here. But in Saskatchewan, it really seems like the person that needs services has to conform to meet the needs of the system, when in fact it should be the other way around. Now, do you ever find yourself advocating for people to reduce their barriers to service?
Absolutely. And peer support is my way of advocating at the Alex, where I do most of my work, because I truly believe peer work is reducing barriers to care. It's improving access. And if you talk to any kind of healthcare provider, it's all about the access in healthcare. And we often think about wait list and the more structural barriers to access. But I can tell you, stigma is the biggest barrier to access. Not feeling like you belong, feeling you're in the wrong place, feeling that you're being stigmatized, that you're being punished for choices. Those are the true barriers, and people not getting care because of those barriers. And then you have peer support staff that beautifully overcome these barriers. They're the conduit into the services. They can really help people overcome these negative experiences and the real lack of trust that exists. And that is not on the clients. That is 100% on the healthcare system, because we have screwed up many, many times. We have done horrendous things. We have shamed people for medical conditions that they had very little choice over. And I really feel there is such a healing element that peer support brings into healthcare that that is my advocacy.
We've got a couple of comments here. Just going to have a quick look. Our friend Onyx says, you beautiful gift is empty for humanity. What? I might have read that wrong. I'm sorry, Onyx. Bless you and your intuition knowing to follow your soul journey. Thanks, Onyx.
Thank you.
And Mary Kay says, "You're so right, Jennifer. I think I'm strong until I talk to someone with lived experience."
Well said, Mary Kay. Well said.
So where would you like to see, where we're currently at with our harm reduction advocacy and where we're at on the front line? Let me take a step back here. A little while ago, I had Nathaniel Day on the show. Are you familiar?
Yeah, I watched it and I know Dr. Day quite well.
Okay, so he was talking
He probably doesn't know me well. I think he's fantastic in the work he's doing. So I know him well, I feel, but he probably doesn't know me at all.
Well, in any case, he certainly, I would say he shifted my perspective a little bit. I try to keep my perspective off the platform. I like to think that Hard Knocks Talks doesn't have a dog in the fight, so to speak. We bring people to come and share their experiences, and we allow our community to pull from that what they find useful. But in any case, he was saying that there is a safe consumption site that will be heavily regulated coming to Alberta in February. Now, sorry, I guess maybe legislation will be passed and there will be safe consumption sites in Alberta where it is very regulated, where someone can come in and use a safer supply at these locations, but they cannot leave with that safer supply because they are trying to minimize diversion. So what are your thoughts on that? Do you think that that's a good starting point for what you'd like to see in harm reduction? Or do you think that we're like coming to the finish line as to how good it can get?
Wow, this is a very loaded question and a very complex question. I think it's an ongoing struggle for us healthcare providers to find the fine balance between treatment that people deserve and should have readily available, but then also balancing that with keeping the public safe and making sure that pharmaceuticals don't get into the wrong hands. My opinion is there is no clear, no easy answer. It's an ongoing balancing act. Has Alberta figured it all out? I want to say no. Is there, is there a hope that we can move towards something that is somewhat balanced? Yes, there is. I'm not sure whether we have it quite right yet, but it's a really difficult fine line that we're trying to straddle there.
Yeah, and I have to agree, and I don't mean to like try to throw you under the bus or anything. That's not my intention here at all.
No, not at all.
So, yeah. So, where can we go from there? Tell us a little.
I'd just like to say, Jennifer, you handled that beautifully. Like it is a very challenging question to answer, especially from your perspective. Like it's hard. So I just want to say kudos on how well you navigated those very I would say whitewater rafty territory.
And that is the whole conversation around substance use challenges right now. It is a whitewater rapid, really, and it's important that we do our best to navigate these conversations in the most effective way that we can. But you told a story, Jennifer, in the talk that you did at CSAM, and I believe it was about an experience you had with a peer support worker and someone who was facing some health challenges in a harm reduction clinic. Can you expand a little bit on that for us?
Yeah, actually, that was the motivation and inspiration for writing this talk for the conference, that I had a very impactful experience. And while I had it, I knew I needed to do something with it because it deeply impacted me. And I kind of figured it would impact others perhaps as deeply. And I was doing the night shift at our supervised consumption site, and it had been an incredibly challenging night with what we call like a bad batch was going around. So people that had been purchasing from the local dealers, they were all overdosing. So it was a very stressful night, just damage control, making sure people get the naloxone and get the oxygen as quickly as possible. And I felt incredibly heavy that night, and not effective, and really challenging, feeling challenged, and really questioning myself and the services I was providing. And there was this young, absolutely beautiful person coming in, and she overdosed hard, meaning that she needed multiple doses of naloxone. She didn't have shallow breathing. She didn't breathe at all, which obviously is a critical medical emergency. And so we treated her, and she finally came to, and she just burst into tears, which is not an uncommon response after having gone through an overdose, very disorienting for a person. And she was just sobbing, "I can't do this anymore. I don't know what to do. I feel so alone." And the peer support worker that had been supporting me with the medical interventions throughout the overdose just naturally took over and hugged that client, which you're being taught in nursing school. You don't, only therapeutic touch. You don't hug people. And she just hugged this client really, really tight and said, "It's okay. You are not alone. We can do this together. I will support you." And I just got goosebumps and shivers. And what was so impactful was the shift in the person's demeanor. Her facial expression from just absolute terror and despair really shifted. And there was a smile, and there was some gentleness in her face, and there was some hope in her face. And that's something that we haven't talked about tonight, but hope is such an elementary concept that we need in healthcare, and that we need in addiction care so desperately. And peers are able to communicate that. And the peer that I was working with that night was able to communicate and communicate hope to this client that was just at her wit's end, and she didn't know what to do. And all of a sudden there was this shift with a hug and 3 sentences. I want to see the medical professional that can have such a shift in a patient's health outcome with like 3 sentences and a hug. So just deeply humbled by that experience, and just reaffirming what I know is true about peer support, is that we need more peers working alongside, because they really move the needle. Where we have that much in our toolbox, we have the medication. In the example I was describing, I had the naloxone and I had the oxygen on offer. I was able to provide that. I, made sure that the person didn't have a brain injury and didn't die. But the peer moved the needle. The peer helped the person, have an idea that there's hope out there, that it's worthwhile moving on. And I finished the TED style talk by saying the peer helped the client, see a life worth living. And that outdoes me with my, oxygen and naloxone, by a long shot.
Mm-hmm. Tell us about how you have changed your practice in working with peer support workers. Like how has that experience shaped the way that you conduct yourself in those environments?
I think I always appreciated my own learning needs and not knowing it all, but I also think hiding behind clinical practice and knowledge and facts definitely was part of my journey. And working alongside peer support workers just really, I think, made me more authentic and genuine and more vulnerable, because that's what peer support is. It's being incredibly vulnerable and sharing in appropriate ways about, your own journey. And I think I'm a much better practitioner being exposed so much to peer support, and really understanding that what I bring, is just part of the equation, but but that the peer is really incredibly helpful for the folks that experience addiction to really move them towards whatever recovery journey that client is on. I think peer support so strongly believes in that every person already carries that really important knowledge and wisdom inside them, what it is that they need and what it is that they need to move towards too, and all the healing and things like that. And the peer support worker with a lot of skill can tap into that and help that client to articulate that and maybe put a little bit more structure around that. And those are things that healthcare providers just we typically don't go there. We are very much top-down medical model. I have the answers. You need to listen. Fortunately, that's not the practice of the medical professionals that I work with, but I think it's common medical practice to tell people what to do versus peer support workers that walk alongside the client. And it's not I'm telling you, but I'm doing with you and I'm supporting you, and we are on this journey together. And I think there's so much empowerment in that. And I think that's where the real change and the recovery and the wellness really lies, is in that, and not the prescription that I give you or the good advice I give you, or very often it's you're doing this wrong, or you need to do things differently. I think that is actually quite disempowering, and the empowerment that peer support staff are able to provide their clients or help them see is where the healing is at.
Mm-hmm. Got a comment here from our friend Barb. Barb says, "We need to keep politicians out of healthcare. Meanwhile, they make all the decisions." Jennifer, do you do any advocacy directed at the government?
My organization is. Our CEO is a wonderful advocate and connected to those avenues that help. I personally consider myself fairly unpolitical, which on the other side, it feels like you can't stay unpolitical or apolitical, I should say, while working in harm reduction, in addiction medicine, with folks that are homeless, because it gets political very, very fast.
Mm-hmm.
My forte is not to advocate at these really high governance avenues, but fortunately I work for an organization that is doing quite a bit of that. And I think we are all good at certain things. I love to be at the front lines, or to provide perhaps a leadership to the folks that do the front line. I really truly believe people need to advocate at that level, and I think the people that have that gift are doing that work. But yeah, very important, because I absolutely agree with your viewer's comment that politicians make a lot of the decisions that impact lives in a major way, and there's not always the clinical knowledge, and there shouldn't be. Politicians shouldn't have to be doctors and nurses and healthcare providers. But I think we need to educate them so they can make better decisions, because as things stand right now, politicians run the show, and we need to help them do a better job at that.
Got a question coming in here. Barb asks, do you think additional training and practice changes could encourage the humble and open approach you demonstrate for care?
The beginning of the question was more education, and can you just read that again?
Sorry. Do you think that additional training and practice changes can encourage the humble and open approach you demonstrate for care? So I think maybe to put it into context is, do you think that this can be taught in a classroom, or do you think that this needs to be experienced, not unlike the way you have?
Wow, that's an excellent question. I think it needs to be experienced. I think we can all read the research, and the body of research for peer support is incredibly robust, and the health outcomes that are demonstrated, the positive health outcomes that are demonstrated by peer support, we should be doing it way more just by looking at the research. But to really fully understand what I personally call like the magic of peer support. I think you need to experience that. You need to have an experience where you see a peer support staff change someone's life. I think that's how you become a believer. You can read all you want and abstractive, in an abstract way and in a cognitive, intellectual way. It makes a lot of sense, but I think you need to experience it to have that visceral connection to this work. So perhaps to answer the question, a little bit of both.
Cool. Well, I think that's all that I really have for you tonight, Jennifer. Donna, do you got anything?
I actually, this might be beyond your scope, Jennifer, and I don't want to put you on the spot in any way. So if it is, please feel free to be like, yeah, I don't, I'm going to take a pass on that one, or call a friend, whichever works. So, what I'm kind of curious about, like, I'm not a healthcare professional, and never taken any training in nursing or anything to that extent, but I kind of wonder if sometimes in a medical setting, like, if some of the struggles that we encounter, say like people going in with substance use disorders or whatever, showing symptoms of, is there maybe a tendency for healthcare workers to have like a degree of self-preservation in that they aren't really wanting to make that connection with all the different patients coming in, because it would be so wearing on a person. Like we hear of it all the time with, peer support workers, frontline workers burning out because of that connection. And of course, nurses and doctors do as well. But I would imagine that would be expedited if they made like a personal connection with everybody. Am I off in the weeds on that thinking?
You know what? I think you're spot on. I think this is a little bit the secret to providing effective care for a long time is figuring this piece out. And I don't think there's a one size fits all kind of recipe for that. I think we need to do both. We need to be able to go home at night and have a personal life and unplug and not take work home. But I think in the moment, being with a patient, being with a client, being able to have true empathy, to feel and to support in the moment. I think we couldn't do the work if we didn't have that. And I think if we start feeling that we can't provide that empathy anymore, we need to make some changes. But also balancing that with being able to unplug and disconnect. And that is something that probably I figure out each and every day anew. I don't think there is just one way of doing it, and it's an ongoing balancing act. But yeah, I think there is a secret to that, to be able to do both, to disconnect, but then also to support. And it's an excellent question that I think everyone needs to answer for themselves, because being on either end of the spectrum won't work. So yeah, really, really good question, and very complex.
And
Okay.
then, sorry, one other question I had as well. Excuse me. I always come in at the end with like these crazy questions. So I'm sorry. What was the other thing I was thinking about asking? In terms of like, because we hear this debate about harm reduction and expectations for end results, like, and ultimately, I think a lot of people assume that means sobriety. And I'm not sure how to ask this question, but basically what I'm trying to get at is like, I wonder if there's some sort of disconnect between, like, from a medical standpoint, trying to get people into sobriety would be the ultimate goal. So in a harm reduction end of things, we just want to make sure people are making it to the next day. So how am I going to ask this question?
Should harm reduction have expectations attached to it?
Well, that is kind of part of it, but is it unreasonable, or perhaps should there be a better or different way of medical professionals being like explained that the ultimate goal is not necessarily everybody has to be like abstinent, Olympic level healthy. You know what? Does that make sense?
I
Like, I'm
love that,
sorry.
Olympic level healthy.
Like, I don't, it just seems to be like such an unattainable goal, you know, if we're all striving for this perfect health, which I think is where the medical sort of model it exists, right? Like everybody should be as healthy as that.
Well, Donna, you make me climb up on that soapbox. I tell you, very, very passionate about that question, and thank you for asking it. I really feel sometimes rubbed the wrong way that we impose our ideas, what's healthy. You call it Olympic level. I absolutely love that. With your permission, I will use it moving forward.
Granted.
And we impose our values onto our clients, and we would never accept that for ourselves. We want choice, and I'm going back to the us and them. I want choice as a human being. I want to decide where I get my healthcare. I want to decide where I go shopping. I want the buffet, at the all-inclusive resort, because I want to make choices. And I think we really need to extend this courtesy to our clients. They are allowed choices, and I'm imposing my values if I communicate that the one and only goal is sobriety. That might work for a lot of people, and for others it doesn't. And I think we are doing our community a disservice if we are making this unspoken holy grail of recovery, that you need to be abstinent to have it made to be, to have succeeded in your recovery or your journey. I can tell you there are a lot of people, they don't have that as a goal, and that absolutely needs to be okay. Sometimes that we don't talk about enough is that there's a reason why folks experience addiction, and very, very often it's trauma. And we keep talking about abstinence, and we keep talking about how people need to stop doing what they're doing, and then we are not giving them any kind of support, even if that is their goal, to make it sober. There's a reason why they started using in the first place, and we are not providing the treatment around trauma, the support. And there's actually quite a bit of evidence-based treatment around trauma. So I'm saying this because I can think of a handful of people where I would be concerned if they were telling me that they want to stay or they want to reach abstinence, because the horrific things that they have experienced, I would be really concerned, because I see how they're using substances as a coping skills, and to make it through the day. And so to say abstinence is something that you need to strive for, I would absolutely love to support you if that is something that you feel is something you want to work towards too. And then I would start having conversations with you. What do you need for that? Do you need trauma support? Do you need psychosocial support? Do you need addiction medicine? Do you need medication to help you reach that, what I would call medication assisted recovery? Just kind of thinking we impose something on a group of people that we would never accept for ourselves. So really, thank you very much for asking that question, because the us and them thing, I think the gap is much, much closer than we think, and we should allow people to have choice. I think that's a human right to have choice, and that's something that I try and incorporate into my practice to allow for as much choice as possible. People need to be able to find what works best for them, and we as a healthcare community don't always make that available to our clients.
We've got a You good? All right, cool.
Thank you, Jennifer. That was an excellent answer.
We've got a comment coming in here, and it's talking about self-care. Brian McGrath says, learning self-care, how to take care of ourselves so you don't burn out. Vacation time, supportive friends, family, etc. And that sort of leads me to a question. What do you do for self-care when you go home at night and things get quiet and you reflect on the day? Like, what are some activities or some tools that you use to keep yourself on the level?
Such an important question. And we have seen so much of that really deep exhaustion coming out of COVID, and lots of people actually leaving the healthcare sector just because they have not found ways to stay well on an ongoing basis. I have created a social support network for myself where I know I can leave things, these impactful experiences that sometimes I do take home. I have mechanisms to share them with others that allow
Peer
me to
support.
let go of them. Exactly.
Hmm.
Exactly. I have an incredibly supportive partner that is doing somewhat similar work. So we are able to share. I have I have a therapist. I have a acupuncturist. I have a mother that is very much in the know with what I do. I have friends. So I think the sharing, we know the social element of being human is so strong. So that is certainly something that I utilize, but also balancing that with being, a true introvert. I love being by myself. I'm a long distance runner. There's nothing better than throwing on that headset and listening to some German techno and pounding out the miles. So it's really important to find support in all four areas: the physical, the spiritual, mental, emotional. And I'm a big goal person. I like writing things out. I have it written out. I have a there is and now I can't remember what this acronym stands for. It's a WRAP. It's a Wellness Recovery Action Plan that sometimes we're using in addiction medicine. And I know some peers use it because it's important for them to stay well, and it's important for everyone to stay well, and to really articulate what does it look like. We teach our clients that. What does it look like when you start feeling unwell, when you feel a relapse coming on? And I'm utilizing very similar strategies for myself. What does it look like when Jen isn't her best self? And developing that insight and awareness. Don't have your kids or your spouse tell you, man, you need a break, you're like awful, you're in a dark place, my friend. Let's not wait for that. Let's develop that awareness where we have these inclinations that things are kind of starting to go sideways. And I know that about myself. I know when things start going down the wrong path for myself, and I stop it, so I don't end up at the bottom of the stairs and need to take a mental health leave, or need to find a new job, or need to be angry at the world or my loved ones or my clients. That would be terrible. So yeah.
Cool. Okay. Well, I guess maybe we'll take you out the hot seat now. I think we've had enough. So unless there's anything else that you'd like to touch on.
Maybe in preparation for this meeting with you and the audience, I was really doing some deep thinking, and what maybe tags on to what you just asked me about self-care. What is probably a huge element to my own self-care is to reflect on how incredibly good I have it, and doing a gratitude practice every day, and also really drawing strength from the clients that I serve. The resilience that I see among my clients is absolutely breathtaking, and uh, it's a really good help for myself to reframe. Sometimes when I think life really threw me a curveball, and then I think about some of the things that my clients went through, I'm like, it's a freaking paper cut, pick yourself up and move on. When I think what our clients have been through, and they keep showing up. They keep showing up at our addiction clinic. They keep showing up at the supervised consumption site or the opioid dependency program. And I was thinking about experience I had Christmas last year, where I was working, which this is my way of celebrating Christmas, is service to others, which I think is very much in step with the spirit of this holiday. And I was working at the consumption site, and there was a client that came in to wish us Merry Christmas and just to simply tell us that they had 2 months sober. They didn't use, obviously. They could have been triggered being back in that environment. They just came to thank us that we helped them make that choice. 2 months sober, I think, is a feat that is incredible. And they just came to tell us, and that I didn't tear up in front of the client, but, I did dab my eye a little bit, when they left, because I thought, I just frickin', celebrated Christmas in a way that most people won't today, because they don't even get the opportunity to have these experiences that I get to have through the clients that teach me so much, and the peer support staff that teach me so much. So hugely humbling experiences that, really meaningful.
Well, and different experience we had this Christmas, but we did have the discussion this Christmas because Christmas fell on a Sunday, and Sunday is show day for us. And we were, well, should we have a show? Should we take it off? And we decided that with the gifts that have come up around us in the community that has come up around us, what better way to spend Christmas than to give, than to elevate voices, and to hopefully bring some hope into the community on a cold Christmas night.
Love that.
I've been through some dark Christmases myself, so I think Dawn is shaking her head over here as well. So thank you for finding joy in service like that on such a momentous day. It's very important. So with that though, I think we'll put a cap on it. Thank you so much for joining us this evening. Thank you for sharing your expertise and a little bit of strength and hope with us. And we'll let you go. Take care, my friend.
Thank you so much, Dan. Thank you. Thank you, Don.
All right. If you're getting something out of what we're doing here tonight, you can find us on all audio platforms like Apple Podcasts, Spotify, Google Podcasts, or wherever you listen to podcasts, or live and interactive right here on Facebook, YouTube, or Twitch TV. Thanks for watching. Take care, my friends. We will see you next time.
Say, this is Hard Knocks Talks.